Namaste, everybody. I am very happy to be a part of this International Women's Day corporate communication. So, moving to our today's topic, it's a very burning topic which needs conversation, discussion, and it should be a part of our daily practice. What do we actually mean by fertility delay in working women? I have seen in my OPD that in the last decade, my OPD practice has actually changed. The clientele or the patients which I usually receive in OPD, earlier would be in the age group of late 20s or early 30s. But nowadays, the couples which seek fertility treatment, they are coming in the age group of mid 30s. So actually, the planning or the discussion conversation of fertility has shifted by a gap of around 5 to 10 years. And by the time the couples seek this guidance about their reproductive potential, they are actually quite late. So, this is what we mean by delaying fertility. So, let's move ahead with the conversation and answer some questions about it.
Correct, ma'am. What are the key factors or reasons leading to postponement or delay in conceiving?
So, if I look from my experience, what I find that basically now the most important reason is much awareness. The priorities have changed. Now, couples, specifically women, they are looking for higher education. They have a lot of aspirations in their career and they are focused to achieve their dreams. So, priorities have changed. Instead of maternity or the motherhood, now the priority is career building. So that is one of the most important reason which we find in our day-to-day practice for delaying fertility or conceiving. Second most common reason is the stress factor. After the COVID era specifically, it is seen that the work from home has become a trend nowadays. Hence, the working hours are extended. Because of that, the stress factor has increased a lot. Hence, there is a lot of stress hormones, and the couples do not spend time with each other. Some people they have night shifts, so they are not even together for 1 hour or 2 hour where they are relaxing and sitting. So keeping relationship has become a mechanical uh, procedure. It is no longer a natural process. That leads to stress factor building and it leads to infertility. The third most common factor is like couples seek for, they wait a very long time for financial stability, and also they seek for a stable partnership. Sometimes they take time to choose a suitable partner, which leads to delay in fertility. Other factors are certain lifestyle factors or the medical conditions. Some women, they suffer from either overweight or they have some medical conditions like which are related to lifestyle, mainly an unhealthy lifestyle, which causes diabetes, blood pressure, and they have to optimize their health prior to conceiving. And hence they think of delaying pregnancy. I hope these are the common factors.
Okay, fair enough. Ma'am, what are the risks of delaying fertility?
So yeah, this is a good question actually. So there are a lot of risks involved if you delay your parenthood. The most important thing is like as you age in women, it has been seen that once you cross 35 years of age, the quality of your eggs and the quantity of your eggs both decreases. Your egg reserve decreases. And in males, it has been seen that after the age of 40, the sperm quality and quantity both decreases. Hence, that vicious cycle of stress that you are aging, your biological clock is ticking, and you have to conceive in a time frame. So that reduced fertility levels compounds the stress factor and which further leads to infertility, because it has been seen that whatever kind of stress, it eventually affects your outcome of implantation, outcome of the quality of the sperms or the eggs. So definitely the risk is like reduced fertility. Then second is, as you age, then there are certain uh, basically medical conditions which add on. The most important is like diabetes, hypertension, and once you conceive, then you have all the more chances of developing pregnancy induced hypertension or gestational diabetes. As a woman ages, it has been seen that there is above 35 years of age, there is increased chances of miscarriages because of genetic defects or chromosomal abnormalities in the fetus. There is an increased risk of preterm deliveries. So all these factors make it a high risk pregnancy. Hence, it should not be delayed for a longer time.
Totally agree with your points, ma'am. What are the challenges associated with infertility?
So there are a lot of challenges which are associated with infertility. The first and foremost challenge is the social stigma which is attached to this fertility factor. So in rural India, it is still considered that if a woman or a couple is not conceiving, it is always the fault of the women. The males, being a patriarchal society, they are not held responsible for infertility. And most of the time, we see that only the female comes for evaluation and the male factor is not evaluated at all. And at the end, we find that females, all the investigations are normal, and it is the male who is lacking in the sperm quality or sperm function. So, what I want to convey is that most important challenge is to alleviate this social stigma, to have education about the awareness that it's a couple thing and both partners should be evaluated together. The second challenge is the financial challenge. Now, a single cycle of IVF, it costs around somewhere from 1.5 to 3 lakhs. So obviously, it's not possible for a lower middle class person to afford IVF treatment. Most of the insurance policies, they don't cover this infertility treatment, and hence it's a burden on your pocket. And once you conceive, sometimes it's a multiple pregnancy and twin delivery, actually the cost doubles. So hence it becomes a financial burden on the couple as a whole. That is again a reason for postponing pregnancy. Third is the psychological factor. So it's a vicious cycle. Once you're not conceiving, your pocket is draining out, and there is a social factor which is involved. It leads to psychological symptoms like depression, sadness, or you feel that it's a curse that you are suffering. So psychologically, you become very low in your work profile also and in your personal life.
Certainly, ma'am. And are there any medical conditions that can further affect fertility?
Yes, both in male and female, there are certain conditions which affect your fertility levels. First of all, if a woman is suffering from like age related diseases which come as you age, so if you have a genetic history of diabetes in family, if you have a family history of hypertension, thyroid disorders, then you are more predisposed to getting these once you cross 35 years of age. And hence, they make your pregnancy a high risk pregnancy, or they causes hurdle in conceiving, because these conditions have to be optimized prior to seeking the fertility treatment. Nowadays, we are seeing a lot of young women in their 30s which are coming with hormonal imbalances. The main reason is the stress or unhealthy lifestyle, which causes irregular cycles. So there is random or irregular ovulation, which leads to delayed conception. So endometriosis, PCOS, thyroid disorders, obesity, all these are medical conditions which causes delay in conceiving.
Okay. And as our topic suggests, the fertility is delayed in working women. So, how is it exactly related? How does the lifestyle factors influence fertility?
Lifestyle plays a major role, at least in this era. So, because of the sedentary lifestyle, there is lack of physical activity, excessive weight gain. So nowadays, what we see that before marriage, the women is too much oriented towards looking beautiful, looking pretty, and adamant to lose weight. But once they get married, they lose that aspiration, and then they do binge eating, they enjoy their life, lot of junk and processed food, and less of physical activity. This leads to excessive weight gain actually after marriage within a short span of 4 to 6 months or 1 year. This leads to hormonal imbalances, and this causes irregular periods leading to irregular ovulation. So definitely a unhealthy lifestyle where in diet you are having lot of processed food, high in carbs with high glycemic index, which causes weight gain. Secondly, less of physical activity, more of stress at the workplace. So, and again, then certain lifestyle factors like certain addictions of smoking, excessive alcohol consumption, excessive caffeine intake, all these factors affect your lifestyle and finally your hormones, both in males and females. And if it affects, eventually affects your fertility levels.
So true, ma'am. So, are there any ways by which women can protect or preserve their fertility?
Yes. So there are several proactive steps which a couple should seek to preserve or to protect their fertility. So most important is to maintain a healthy lifestyle. So when you know that you are doing work from home, somehow you should take time out for yourself where you are either doing certain amount of physical activity. It should not be yoga or anything which you don't like, but some physical activity which you actually love doing, whether it is dancing for 20, 30 minutes, whether it is playing badminton or swimming, whatever you like, but some amount of physical activity is important. So a healthy lifestyle, including a healthy diet and lot of physical activity is required. Second, you should be able to manage stress both at the workplace and at home. Your working hours should be fixed and try not to take the workplace stress at home. And whenever you are keeping relationship, don't aim for achieving pregnancy in that act itself. Nowadays, couples come to us that this is my ovulation window and we keep relationship only during this period. So that should not be the way. It's not a mathematical procedure. It should be a natural thing. When your natural hormones are activated that time, you know that the body functions that way and chances of conceiving are more. Third most important thing is awareness, that you should seek the fertility guidance from your gynecologist. You should know your biological clock, your fertility timelines, and the options of fertility preservation. So this conversation or discussion about the reproductive potential, it should be conducted at an early age in your early 30s when you can discuss about various options like how much time you have and what are the risk related. Then nowadays there is an option of egg freezing or oocyte cryopreservation. The best age for oocyte cryopreservation starts from late 20s to early 30s. So somewhere between 25 to 35 years of age. If a couple comes after 35 years of age, then that precious window is lost. So all these awareness needs to be there so that the couple is proactive.
And talking about um, preservation of fertility, I think uh, there must be some assisted reproductive technologies. So, do these technologies solve the problem completely?
So not exactly. That's what with advancement in technology, with artificial intelligence coming into picture, there is no doubt that assisted reproductive technology, whether it is IVF, ICSI, they have showing good results. But obviously there is no guarantee with these procedures. And secondly, they can't beat your biological clock. There is no way that they can manage the medical diseases or the age factor which causes this fertility. So sometimes definitely we need to use donor egg or donor sperms. Still, your body, your uterus should be good enough to hold the pregnancy. So definitely there is no foolproof method or IVF procedure which guarantees 100% pregnancy rate.
So, if there is no foolproof method, what's the solution? What's the way ahead?
So as we have discussed till now, what we see from our present experience, that there needs to be an increase in the awareness about the reproductive potential, about the fertility timelines. So most important thing which we feel is that basically we have to integrate mental health along with the fertility counseling. So whether a couple is seeking IVF procedure, there the emotional counseling should be a part and parcel of the IVF procedure. They should be every month, the women or the couple should not go through a cycle of hope and grief once the menses arrives. So the mental health has to be addressed and awareness is important. Second thing is that what insurance companies can do, that at least partially the parenthood procedures like oocyte preservation or like IVF procedures, they can be partially covered in the insurance. Third thing is workplace sensitivity. The workplace or the employers should be sensitive enough to consider and give leaves for seeking fertility treatment, and they should also cover this in corporate insurance. I think if we are, and then maintaining a healthy lifestyle. So if couples themselves are aware about the wrong or the side effects of a unhealthy lifestyle, they will be aware and seeking the health advice at an early age.
So, okay, ma'am. What are the common myths associated with fertility and working women?
So the most common myth which we see is that the women, most of the women feel that they can conceive at any age. So that's not the reality. As you age, once you cross 35 years of age, your egg reserve decreases and the quality of the egg starts to decline. Second common myth is that the infertility happens only because of the women partner. So as we have discussed, that 45 to 50% cause of infertility actually is the male factor. Hence, the couple should be evaluated together for the fertility potential. Third common myth is like birth control pills. They cause infertility. It is not true. Once you stop doing birth control pills, you can conceive in the next cycle itself. One more myth which we commonly hear in our OPD is that with advancement in ART or IVF treatment or centers, couples have this false perception that they can conceive with IVF at any age. So again, that is not true because IVF can help you in optimizing the egg quality or the donor egg or your sperm's quality. But finally, your uterus, your body should be perfect enough to hold the pregnancy for 9 months to and have a happy outcome.
So, as we conclude today's session, what is the key takeaway message for the working women from you, ma'am?
So the most common or the most important message which I want to give to most of the working females today on this International Women's Day is that no doubt your career is very important. Your aspirations, your dreams, they have a place, an important place. And because of the women empowerment, we are seeing a lot of women in high positions with high regards. But your fertility planning and career both should never be in conflict. So nowadays, fertility planning is not an anticipation, it has become a choice. But that choice should be an informed choice. You should be aware about your fertility potential, about your biological clock, about your body, whether it is fit enough to conceive, at what age your egg quality is best. If you have knowledge, awareness about these topics, then definitely you can make an informed choice to have pregnancy at a certain age. If you want to delay it, again, there are methods which help you to correctly guide towards a healthy outcome. So, your career should never come or become an obstacle in fertility planning.
Thank you so much, ma'am, for this insightful session.
Thank you. Thank you. It's my delight to be a part of this wonderful conversation. Thank you.